Hello, I'm Dr. David Hornbrook, the Clinical Director of Education and Technology here at Keating Dental Arts in Irvine, California. Today I'd like to talk to you about the advantages of a material we're very excited about, and that is the KDZ Ultra. Now the KDZ Ultra is a zirconia oxide coping, almost like a porcelain fused metal crown, that's overlaid with beautiful layering ceramic. So if we try to compare the three, gold and the PFM and the Ultra, gold is tried and true. It's a very conservative prep, but it's obviously not aesthetic. And we even have patients in our practices now that come in and they have beautiful gold restorations, and even though they're clinically acceptable, they want them removed because of the aesthetic value. So conservative, time-tested, but not aesthetic. Then we have the porcelain fused metal crown, again time-tested, but because it has a metal coping or core, which initiates grayness into the prep or the final restoration, we need to overlay with ceramic. Now, if we provide enough room, then these can actually look very, very aesthetic, but this is a very aggressive prep. Typically, we'd like to see, or the ceramist would like to see, about 2 millimeters reduction so they can actually hide the influence of the metal core or coping. Which brings us to the KDZ Ultra. Again, this is a zirconia core, similar to a PFM, but it's tooth colored, and it actually has some translucency. And then we overlay with beautiful layering ceramic. So if we look at the three advantages here, let's look at conservation of tooth structure. Typically with gold, we would see a restoration that can be as thin as 1 millimeter on the occlusal, maybe even a little bit thinner, and 3/4 to 1 millimeter axial and facial reduction. PFM, 2 millimeters. A KDZ Ultra, because of the translucency of the core, we can have this to be as thin as a millimeter on the occlusal and 1 millimeter to 1.5 millimeters on the axial wall. So it's a more conservative prep than the PFM, not quite as conservative as the gold. Now I'll show you a model here. It's very cool just to show you the aesthetic value, because the KDZ Ultra, having a relatively translucent coping, is zirconia, but when it's only 0.5 millimeters thick, it's relatively translucent. How we can get aesthetics that improve over the PFM. So here we have a PFM on the right side, an Ultra on the left side. These are little LED lights, and you see as I turn on the LED light, we can see the light transfer from the inside of that Ultra. We don't see it at all from the PFM. And if you go back to your practice, what you're going to see is porcelain fused metal crowns that just jump out at you and say, look at me, I'm the fake one, because light could not penetrate through the restoration and light up that root, so we get that dark shadow where you can see the Ultra looks almost like a natural tooth. Now, if we look at other factors here, let's look at cost for the patient or cost for you as the dentist. What's the most expensive? Gold. That's our most expensive restoration that comes out of Keating Dental Arts. Second is a porcelain fused metal crown, especially if you use a precious or semi-precious. And the least expensive is the KDZ Ultra. Now we look at marginal fit. We see a KDZ Ultra very close to what we'd see with a gold crown. Also, because this is translucent, we can keep our margins super gingival. Where obviously with a porcelain fused metal crown, we typically bury our margins subgingival, so we eliminate or inhibit the influence of the metal. So hopefully that clears some things up regarding the advantages of our KDZ Ultra.